crest. So the iliac crest will be at this level, and now this is the urinary bladder. This will be situated inside the pelvic cavity. That is the true pelvis. Okay, and here will be the iliac fossa of the ileum, and above that there is the iliac crest. So this distance will be 2.5 cm. Now when you see the both kidneys, that time you will understand that the right kidney is on the lower side than that of the left kidney. Why it is so? Because the right kidney there is the liver which is placed into the right hypochondrial region. Okay? And now because of this position, the transpyloric plane which crosses the hilum of both the kidneys, it will be on the upper side of the right kidney and on the lower side of the left kidney, because it is on the higher side, left kidney, but right side it is on the lower side. Okay. Now these are we have seen this both the organs, they are retroperitoneal. That is, they will lie behind the peritoneum. Now what is this peritoneum? It is the covering of the peritoneum. Whole of the abdominal cavity is covered by parietal peritoneum, and the organs which are placed in the abdominal cavity are again covered by the visceral peritoneum. And in between the parietal and visceral peritoneum there will be a peritoneal cavity, and inside this cavity there will be the peritoneal fluid. Okay, so that will protect the organs also, and it will protect the friction also in between the two organs. Now we will again go on to the kidneys. Now the height of the kidney or the length of the kidney you will see. So the dimensions or the external features, that is the shape is kidney or the bean shape. Then it is length is 11 cm, so this will be the length 11. Then is the breadth 6 cm, and the thickness will be 3 cm. The weight of the kidney, in males it is 150 grams, in females it is 135 grams. Now where they are situated we understood, but in which 9 quadrants they are situated. So we will see the quadrants. On the right side it will be situated into the right hypochondrial, then
Gastric,
right lumbar, and
umbilical.
that is for the right kidney. And the left kidney also the same, but on the left side that will be the left hypochondrial, then left lumbar, then left
Gastric,
and
left umbilical.
these are the 4 quadrants they will occupy, okay, right and left kidney. Now we will see the impressions on the kidney. Now this is the anterior surface, this will be the posterior surface. Now as you know that the kidney on the right side will be having impression of the superior bone, there will be the suprarenal gland. So you will see in this figure also. So in this diagram you are seeing the impressions on the anterior surface of the right kidney. Superior bone, there is the right suprarenal impression. This is the hepatic impression. Then at the hilum, this is the hilum. Here there will be the duodenal impression. Now duodenum, what it is? It is the first part of the small intestine. Then from the small intestine, that is from the duodenum, it will be continued as jejunum. So then you will have the impressions of this jejunal points. And now the jejunum will continue as ileum. The right iliac fossa, it unites with the cecum, and ileojunction is formed. Right iliac fossa will contain the cecum, and त्याच्यामधनं मग large intestine start. So large intestine will ascend, and it will go ascending colon is formed. Now this large intestine will take a bend on the right side, and it will give to the right hepatic flexure. So colic impression comes from the anterior side of the right kidney. So now we revise again. This is which impression? Right
Suprarenal
impression. Or it is also called as adrenal impression. Then this is the impression
For the liver,
hepatic
hepatic
impression of the liver.
liver.
Then at the hilum, this is the
Duodenal impression.
Duodenum. This is the first part of the small intestine. Then is the jejunum at the lower pole, and on this area there is the impression of the large colon, that is the right hepatic flexure. Okay, so this was all about the right anterior relations. Now we see on the left relations of the anterior relations of the left kidney. This is the superior bone. Here there will be impression of the left suprarenal gland. Now on the left side, that is the left hypochondrial region, there is stomach. this. And on the fundus of the stomach there is the spleen. So this is the splenic impression. Now in the C shape of the duodenum there is the pancreas which will go on to the hilum of the spleen for its attachment. So here you are getting the pancreatic impression on the left kidney. Now below these are the coils of the jejunum will come and they will take an impression. And here you will see the polypotic impression. So these are the impressions on the anterior side of the kidney. Everyone understood? Yes. So can anyone summarize? Impressions on the right kidney. Along. Right kidney.
First is the right suprarenal impression. Then we have the right hepatic impression of the liver. Then we have duodenal impression.
And
Colic impression. Jejunal impression.
And what is the difference in the left side? We see more. How many organs? Gastric impression, splenic impression, and anterior. But duodenum is absent because it is situated on the right side. So these are the differences between the two kidneys. Okay. Now on the hilum, what three structures you are seeing? The hilum is what? It is the entry which the vessels will enter inside the kidney or they will leave the kidney. So from ventral, anterior to posterior, first you will see the renal vein, then is the renal artery, and then third is the renal pelvis which will continue below as the ureter. Okay, so both the kidneys will have these three relations. First renal vein, that will what it will go outside the kidney and it will enter the iris, that is the inferior pericardium. Then the renal artery will go inside the kidney. From it is a branch of abdominal artery. And now the ureter will leave the kidney. What it will do? It will carry the urine which is formed inside the kidney. Where it will carry?
Ureter.
So they are just the collecting muscular tubes which will carry the urine secreted into the kidneys to the urinary gland. Understood? Okay, so this will now we'll stop for today.